Audio recording, primary assessment. General impression from a position where I can see the patient, I will determine if they are sick or not sick. Looking at their facial expression, their eye contact, how they dress, how they speak whenever I approach them, smell of body odor or breath or vomit or urine, how many words per sentence they say, abnormal sounds or positions, retractions or nasal flarings. Look at their skin. If they're red, it indicates fever, sunburnt, anaphylactic shock. If they're white, it indicates shock or anemia. If they're blue, it indicates cyanosis. I will determine their level of consciousness by using the AVPU acronym: alert, verbal, painful, or unresponsive. I can determine if they are alert by asking, "What's your name? Do you know where you are? What time it is?" I need to determine the chief of complaint and apparent threats to life, asking, "Who called EMS?" or "Why did you call us today?" And I need to make sure the airway is clear, breathing is normal, and their circulation, if there's any major bleeding that I can't ignore. A more detailed examination of the airway and breathing, I will note how fast or slow their breathing is and listen to abnormal noises. If I need, I will open and secure the airway, looking for chest rise and fall, assessing adequate ventilation. If I need, I will administer oxygen therapy using a normal breather at 15 liters per minute or nasal cannula at 6 liters per minute. Also assessing circulation, I need to control major bleeding if needed. I will also place my wrist on their forehead to assess skin color, temperature, and texture. At the same time, I can feel for a radial pulse, not counting the rate, just feeling how fast or slow. If I can feel a radial pulse, I will go to the carotid artery in the neck. Assessing their disabilities, I will take my flashlight, first shining in the right eye, but looking in that right eye to see if it constricts, pulling away, and then going back in that same eye to look at the left eye to see if it constricts the same, and then go to the other side and do the same thing. Also start calculating the GCS from there. Expose the chest as needed, listening to lung sounds and heart sounds, and place leads if needed. I will determine priority patients, decide if this patient is a load and go critical or a stay and play non-critical patient.